let's talk about pituitary tumors. What is the pituitary gland? The pituitary gland is the most vital hormonal gland in our body. It actually controls most of the hormonal production, the management, the levels by producing various hormones. It is located deep inside the brain towards the center, just below the level of our optic nerves or the nerves of the eyes. Now when you have a pituitary tumor, first thing to understand, most of these tumors are non-cancerous. It's extremely rare to have a cancerous tumor in the pituitary gland. What can happen when these tumors are there? So these tumors can present in two ways. One is, some of these tumors can produce hormones. Now the hormones which are normally produced are prolactin, which is actually can lead to amenorrhea or disturbance in menstrual cycles in ladies. It can lead to breast enlargement or breast discharge, milky discharge from the breast in ladies and in men. It can present with increased production of cortisol, which is actually the normal body steroids, which can cause side effects of excessive steroids. It can cause production of excessive growth hormone. That is a hormone which is there for growth. If it happens in younger people, you can have excessive growth, like what we call giants. And if it happens in older people, it's called acromegaly, where our face, our nose, our lips, our hand all become thicker. We can't grow because our growth is already finished, but all our body organs, all our bones all become thicker and more coarser. The other way it can present is with increased size. As the tumor becomes bigger, it can go and press on our optic nerves. The distance between the pituitary gland and the optic nerve is about 2 centimeters. As the tumor becomes bigger, it starts pressing on the nerve, and people can present with decreased vision, difficulty in seeing things, or blurring of vision. And in very rare cases, if there's like sudden bleeding inside the tumor, it can suddenly cause sudden vision loss or other hormonal problems. A pituitary tumor is normally diagnosed by an MRI of the brain, normally a contrast MRI of the brain. Along with that, a certain set of blood tests to evaluate the hormones may be done, and in most cases, the tumor requires surgery. Nowadays, with modern techniques, we can do what's called an endoscopic transnasal surgery. That basically means using an endoscope, we can go through the nose and remove the tumor completely. In certain cases, when the tumor is a prolactin producing tumor or a prolactinoma, you can normally be treated with just medication without requiring any surgical intervention. Thank you.